Our country is in the middle of an unprecedented mental health crisis, and its true cost is laid out in a new landmark report called The Economic Burden of Mental Health Inequities in the United States.
Over a 4-year period, 2016 to 2020, because of our failure to address this issue, we lost 117,000 lives and we lost $278 billion. When you really look at this, disaggregate the data, and you look at the impact on marginalized, minoritized, and medically underserved communities, the impact is even greater.
And that was pre-pandemic. And if we don't take action to increase and improve mental health care now, it's projected to cost us $6 trillion by the year 2030. So why aren't policymakers being more proactive?
We have this hierarchy of chronic diseases, and truly what people need to understand is that this is not an acute issue. It's not a temporary condition. It really is a chronic condition. And yet within this hierarchy of chronic conditions, we know that mental illness, we know that substance use disorder fall very low on the totem pole, and that's really unfortunate.
But there are things we can do to create change.
I think first, it's helping us to reduce and eliminate stigma, right? I think a lot of folks are still embarrassed to come out and admit that they have a mental illness. 20% of Americans have mental illnesses, right? And we see that consistently among all the racial and ethnic groups. And as we age, 50% of Americans will be impacted by mental illness. So I think, one, it's helping to reduce the stigma. Two, it's engaging and making sure that your voice counts, right? That you're out there voting and ensuring that our policies, ultimately reflect the values of our time, that mental health is worthy of investment.
You can read the full report at satcherinstitute.org.